Thank you, Nicola, for introduction, and good afternoon and kind regards to all the participants of our meeting. Today, in my first talk, I will discuss the FH screening programs in the Europe. So, as it was previously stressed, FH is severely underdiagnosed, despite it's the most frequent life-threatening metabolic disorders in humans. Solely in Europe, over 2 million people are affected, and there are very few countries where detection rates are over 10%. So we can say that over 90% of all people with FH is currently still undiagnosed, also in Europe. The recent Lancet Global Registry results emphasize the need for early detection of FH already in childhood. So childhood offers several opportunities for effective FH screening. It offers best discrimination of monogenic and multi-factorial hypercholesterolemia. In most countries, there are some population-wide preventive or healthy children visits. There is a good possibility of early lifestyle and therapeutic interventions that, if we want to last later on, should be introduced in childhood. And there is easy to add child sibling or child parent FH screening. And of course, having a healthy parent is a child very best interest. So by FH screening, it's possible to impact in a favorable way the CVD risk profile of the whole family. And what are the data for Europe? Based on our global FH screening survey, there are several countries in Europe with implemented nationwide cascade screening, most notably the Netherlands, the Denmark, Sweden, Norway, Austria, the Czech Republic. But on the other hand, there are very few countries with introduced universal screening. Slovenia has it as a nationwide program, and there are some pilot programs running in Czech Republic, Slovakia, and there are some regional-based programs in Germany currently and in Greece. There is also a divide in Europe regarding the percentage of children with access to cholesterol measurements. In several countries, it is a great majority of children with access to cholesterol measurement, but in the others, relatively few children have access to cholesterol measurement. Also, with regard to access to genetic testing in children, there is quite a variety of situations in Europe. In some countries, it's available, but in the others, not. In general, we can claim that great majority of countries have at least some kind of organized programmed healthy visits during childhood, several of them during many different time points. And these healthy programmed visits offer a good opportunity for FH screening if we want to do it universally. Recently, best practices were recognized by the Public Health Best Practice Portal by the European Commission on pediatric FH screening. And there are some most prominent programs listed at the portal as best practices, which is a very good basis for potential generalization of these programs throughout the Europe. So what are the barriers to screening implementation in Europe? The most important barriers perceived based on our global FH survey is lack of financial resources, lack of support by government, lack of institutional support, and that FH is currently not a healthcare priority in a country. So to conclude, FH should be screened, and the optimal model depends on the healthcare system of country or on particular conditions in each country. In EU, few existing FH screening cascade and universal programs already exist, and several more pilot programs are already taking place. Cholesterol measurement is frequently available to children in EU, but somewhat less available is genetic testing. And in majority of countries, a population-wide programmed visits of children do exist, which are a good basis to potentially add also the FH universal screening at that points. What are the main barriers? The major perceived was a lack of financial resources. The others were lack of support by government or their institution, and that FH is currently not a healthcare priority. And recently, best practices in FH screening were recognized by the European Commission and are now available to be potentially generalized throughout the Europe.